And welcome back to the Morning Blend with our continuing series, Today's Senior with Synergy Home Care. Well, most seniors want to stay living in their own home, so today we're going to talk about some historical changes in Medicare that are allowing you to do just that.
And this is a big deal. So we have Ruth Busalacchi from Synergy here along with Sandy Raasch, an insurance advisor with Platinum Benefits Group.
Thanks for being here, you guys.
Thanks for having us.
Thank you.
Absolutely. So this is a big deal. Medicare benefits, they traditionally kind of offered services that were not including home care. This is something new, correct?
Medicare has always included home health care when it was medically necessary.
Okay.
And I'm sure you've heard of a nurse coming to the house or a physical therapist. What is new is non-skilled home care. So that is a person who is needing help with dressing and various sorts of things that Medicare doesn't say is medically necessary. Yet, if you have a hip replacement, you can't bend over and put on your socks and shoes for 6 or 8 weeks. This new benefit allows a non-skilled home health aide like Synergy to come to your home and do it for you. And while they're there, they can do other things like fix your breakfast and other things that you may need just to keep you at home.
I think that sounds really good to people.
So like what are some of the things a home healthcare person would do then if it's not physical therapy or a nurse?
Right.
Are we talking help with prescriptions or?
The things that they can help you with are housekeeping.
Okay.
Things you can't do because you're either physically disabled or maybe you have a medical condition. Run your errands for you or take you to doctor appointments.
Okay.
Laundry's often in the basement. Some people actually need a little bit of supervision. Maybe they live with a family member and the family member needs a break or needs to get out of the house. So it's all of those things now with this Medicare covered benefit, we can go in and Medicare will cover.
Why are they doing this change? Because I think in general, people are going to say, well, it's time. We've wanted something like this. It's something people want. But why has the change been made?
Medicare recognizes that it costs less to provide the service in your home rather than in a rehab center.
I see. So that's important.
Yeah, it's also important to understand that this is a service that they have authorized exclusively for people who have Medicare Advantage plans.
Okay, so this is an Advantage plan that would go on top of your basic Medicare.
Instead of.
Okay.
Yes, a Medicare supplement, or what they call a Medigap plan, goes on top of your Medicare. It pays whatever Medicare would authorize, but not cover that 20%.
Can people just opt into the Advantage plan when the time frame is open to review their plans?
Yes, every October 15th through December 7th, a person may select a Medicare Advantage plan. There's only one health question, and that is, do you have end-stage renal disease? If you don't need kidney dialysis, you're eligible for any Medicare Advantage plan that you choose.
Wow.
How many people do you think are going to take advantage of something like this? You probably have a lot of people who want to stay in their home, but they need that extra help. And how are you going to get the word out?
Today is a perfect example.
One way, right here.
So listen up.
We're spreading the word to our rehab center social workers, discharge planners in the hospital. Of course, we're calling our existing clients, telling our own family members, anyone who has Medicare, it's a time to look. And then, of course, we have Sandy, who's able to educate someone and really help them find the right plan.
What have you heard from people as you've started talking about it, Ruth? Like, as you've heard, you've told participants and you've talked to people who are potentially already your clients.
Right.
What kind of response have you gotten from people? Because I can imagine people are like I said, finally, this is
super
so
excited,
important.
Right. They're excited. They're a little confused about it because it is so new. And frankly, not even the doctors are all completely, fully understanding how it works. So often we're referring people back over to Sandy to help them navigate
and educate
and enroll. Right. Yes.
A doctor has to order it. Just like they order the skilled nursing care, they have to order the non-skilled nursing care as well.
And does that have to come from a specialist or can it come from your general doctor?
Any doctor.
Any doctor.
That is treating that person and determines that it is appropriate for them to have that service. Usually it's on a temporary basis. It's not over a permanent thing. It's while they're recovering from an injury or an illness.
Sounds like this is a much needed addition, you know, as people are aging and in more help they need.
Absolutely.
And at Synergy Home Care, we really have focused on trying to find ways to help people supplement the cost of our care. So as soon as this became an option, I was committed to finding, contracting, spreading the word, and getting the word out there. So right now we have a contract with Medicare, Anthem, Blue Cross Blue Shield, Medicare Advantage.
You guys do great stuff, and I know people just love the care that you provide. So I want to make sure that people know, because right now there's a free Medicare Seminar that you guys are offering, so people can take advantage. It's Thursday, October 3rd. It's at 10 a.m. It is at High Grove Senior Apartments, and that's right on Prairie Hill Lane in Greenfield, again at 10 a.m. So you can take advantage of that. The phone number to call, you can reach Sandy at 414-467-9199. Also, free home care consultations with Ruth and Synergy Home Care. The phone number for that on your screen is 414-763-8368 or synergyhomecare.com to learn more, and they can help connect you as well with all of these services. Make sure you take advantage of learning everything you can. Thank you so much,
Great
ladies.
information.
You're welcome.
Appreciate it.